Hi, I'm Dr. Donna Ryan, and I am Professor Emerita at the Pennington Biomedical Research Center in Baton Rouge, Louisiana. I'll be attending the ECO conference and discussing the RESET trial. This was a study that we did with a very special capsule called Epitomee. It's not really a drug, though. It's a device. And so what the RESET trial was about is we had earlier demonstrated the efficacy and safety of this drug in a randomized clinical comparison. So in RESET, what we did is we went back and we looked to try to identify if the individuals who had the best responses to the capsule. Epitomee is a small capsule, and inside that capsule is a polyabsorbent gel. So it's unique in that there are really two types of gel in there. It contains a shape-shifting, superabsorbent gel within this capsule. So what it is on the outside, there's a polymer that forms a triangle, and on the inside is the superabsorbent gel. So when you look at it, it's just a tiny capsule, but the polymer on the inside holds it into the shape of a triangle, and inside that triangle is a powder, and that powder it absorbs 100 times its weight. And so what happens when you take the capsule with a glass of water in your stomach, it expands and forms a triangle, and the triangle touches the wall of the stomach, and it makes the stomach believe that there is food inside. And so the stomach has stretch receptors that work through the vagus nerve. It goes up and it tells the brain that food is on the way. So what it really does is it promotes the feeling of fullness, and you eat less. And when you eat less, you lose weight. So that's how the capsule works. Now, it doesn't stay there very long. So in the stomach, after about 2 hours, the gel begins to disintegrate and it passes through the body naturally. So this sort of technique has been tried before, but the capsule is unique. And what makes it unique is that the triangular shape doesn't contain a huge volume of the superabsorbent polymer. Sometime in the past, there have been capsules that just contained the superabsorbent polymer. And what happened there is it produced a very large burden of this mass in the stomach. The burden of this is much, much less. So it has its effect by stimulating the stretch receptors, not by forming a big mass within the stomach. And that's good because that big mass can be difficult to dissolve and excrete. This, no problem. So that's how it works. The original study was testing the gel in a capsule or a placebo capsule that looked identical in individuals who had overweight and obesity. And so they were given twice a day the capsules with a glass of water before their meals. And then we monitored them for 6 months and measured weight loss. They were also given dietary and lifestyle advice to reduce caloric intake and to increase physical activity. So even patients on the placebo were able to lose some weight. The Epitomee capsule patients, though, lost significantly more weight than those on the placebo. So after 6 months, the study ended. What we've done here in the RESET study is we've gone back to look to identify which group of patients, what were the characteristics of the patients who had the best response. You know, one of the things that happens in weight loss studies, and we see this in every treatment, whether it's lifestyle, whether it's medications, or whether it's bariatric surgery. One of the most interesting things about the weight loss studies is this huge variation in response, in the weight loss response. So some patients will respond very well, and other patients will respond not so well. So it's important to identify the patients who are the responders so that they don't have to take the medication or the treatment for a long time. So what we looked at in the RESET study was individuals who were able to lose at least 2% in the first 8 weeks. Very interesting. Well, both the placebo groups and in the Epitomee groups, early weight loss predicted long-term success. However, the long-term success was, of course, greater in the Epitomee group. And what we found that was that on average, those who were early responders who lost 2% at 8 weeks were able to lose almost 10%, on average about 9.3% at 6 months, at 24 weeks. And for the placebo group, it was significantly less. It was 6.9%. More important is that it helped predict individuals who were able to achieve certain benchmarks of success. In obesity treatment, we're always trying to reach a target, and that target is usually at least 5% or even better, 10%. And so 79% of the Epitomee-treated patients who achieved that early response achieved 5% weight loss, and 40% achieved 10% weight loss. So what this does is it allows us to identify early on patients who are going to have ultimate success with the Epitomee treatment. I think it's so important in managing patients with obesity to recognize that not everybody needs to lose 15, 20%. Not everybody needs medications, which are systemically absorbed and have side effects. Some patients can do very well with lesser weight loss. And it's very important to avoid those side effects in some patients. So I think one of the findings overall with the Epitomee capsule is that it really had no side effects that were different than placebo. So it's good to have a medication that can produce moderate weight loss, which produces health benefits, and also which has no side effects. So I think the take-home message is that for people who are doctors who are trying to help their patients lose weight successfully and safely, we have a very good option in the toolbox. And this medication is associated with moderate weight loss in many patients, and it's also associated with an extraordinary safety profile and an extraordinary tolerability profile. So a safe and effective, highly tolerable medication in the toolbox that for many patients can produce good levels of weight loss. And we can predict who the responders are going to be by just looking at those who lose at least 2% in the first 8 weeks. What we would like to see is real-world studies. So this was done in a randomized clinical comparison. And we would like to see evidence from large-scale studies in the population of how Epitomee is performing. So I think that's the next step. So we've translated it to the bedside, and now the next translation is into large populations.